All right, so picking up where we left off in chapter 7, this is slide 7 in chapter 7. Once again, want to emphasize that this chapter is really full of vocabulary, so that's what I want you guys to concentrate on. When we take quiz, this is going to be quiz 12, which will likely take early next week over chapter 7. It's going to be 100% vocabulary, just so you know. So concentrate on that. Okay, so we talked about the different types of microorganisms that we either need to kill or inactivate. So let's head on from that. Okay, so one thing that I want you to know are the two prefixes that I've listed here. Hold on, let me get a swig of my Bang energy drink. Seriously, I should try to market this and get a sponsorship from Bang to make these videos. God knows I support him financially. Okay, so there are two different suffixes that I want you to know. So the first one is side, which means to kill. So when you see that at an end of a word, it does. It means that the goal is to kill the organism. Right? So bactericide, it's a chemical that we want to kill bacteria. Notice vegetative bacteria, not spores. Fungicide, we want to kill fungi. Viricide, a little different because remember, viruses are not alive. So it's a chemical that we talk about inactivates viruses. Sporicide, we're going to kill spores. Two generic terms that you might hear are germicide or microbicide. That means that it's kind of an all-encompassing term. It means that, yep, we're gonna try to kill or inactivate, bacteria, fungi, viruses, everything that's in there. But side means to kill. So I know you've heard the term homicide, okay? That obviously means to kill. So the other term is static or stasis. And this means that we're not going to kill everything that's there, but we're going to prevent the growth that is currently happening and hold it there. Okay? Now, why would we want to do that, right? Because if we have a pathogen, well, let's just get in there and get her done. Let's either kill it or inactivate it and just, blow it out of the water. Well, especially when we're talking about chemicals that are used inside the body, such as antibiotics or other antimicrobial drugs, most of the times we can't administer those to us or our patients in a cidal type of level. It'd be great if they could, but one thing you're going to learn, especially when we get to chapter 20, is there does not exist a drug that does not have side effects. And the more you increase the concentration of the drug, the more you see the toxic side effects. And so many drugs that are given to you are prescribed by healthcare providers and then also guided by pharmacists to be given to you in static levels. And the reason for that is to, first of all, minimize side effects to you from the toxicity of the drug, but also you have an immune system. And when we are fighting against a pathogen, we expect that immune system to step up and do its part. And so if the drug can stop, future growth of that organism or future replication of that organism, then hopefully your immune system is going to have time to kick into gear and kind of back clean up and do its job to stop and then remove that pathogen. So there are luckily some drugs that at very low concentrations will still be cidal, which is great, but not very many drugs operate like that. And so, to minimize toxicity, they are prescribed to us in static levels. Okay, so if you see something labeled as bacteriostatic, that means that it's going to prevent any future growth of bacteria. Fungostatic means inhibiting future fungal growth. Microbistatic, okay, a term that you might see associated with a lot of drugs that are prescribed internally, so they interact with our own physiology. and yet more terms, yay. Okay, so a couple of these are kind of blurry, and so, I'm only going to include terms on your exam and on your quiz that are very clear cut. The ones that use sanitary or sanitize, those are kind of gray area terms. It's basically, if something is sanitary, it doesn't mean that it's sterile. And it also is, it's not free of pathogens, but the pathogens have been lowered to a level that it's going to be safe for someone who has a normal immune system. Okay, so for example, when you see like a boil order in your community, that means that it's specifically going to be, dangerous. Let's say it's in the water supply, that it's dangerous, especially for people who are immunocompromised. They're babies, or they're really elderly, or their immune system is not operating at full capacity. Okay, so keep that in mind when you hear boil orders. And it's what we're hearing with COVID-19 too. It's especially fatal in people who are more immunocompromised. Okay, so sanitizer, obviously you guys deal a lot with hand sanitizer. Sanitization is kind of including in the physical process as well as, scrubbing. But these are kind of, gray area terms. The one term that I want you to know from this slide is this one. So degermation means short-term antisepsis. Okay, so remember, antisepsis is where you are basically trying to disinfect living tissue. So determination, it means you're trying to do it short term. So best example of this is when before you get an injection or before you give blood, the person, administering that is going to rub your skin with an alcohol wipe. And that is going to be antiseptic, but it's short term. Just allow them to get that needle in and then take the needle out, and then they're going to put a Band-Aid on there, and wrap it up. So that's what degermation is. It's short term antisepsis. Sanitation, I do want you to know. So this is another example of, as though things are very inconvenient for us all right now, let's thank God that, or whoever, that we have a system of sanitation, and we are lucky enough to live in a place where there is a public health department. So sanitation refers to public health measures taken to ensure that water, etc., has levels of pathogens below which would make a person with a normal immune system sick. So keep this in mind, that when we, drink our, tap water, which, unless we hear from the water department and our public health department, it's safe to do that. It doesn't mean that it's free of pathogens. What it means is that the level of pathogens are being kept below a level where they would actually affect you. Okay, so your tap water is certainly not sterile. So sanitation includes things like a water treatment plant. It also, thankfully, is the people that come around once a week and take our garbage away, so we don't have to live with huge piles of garbage. So we, next time you see your garbage collection person, give them a wave, give them a shout out, say thank you to them, because that's the only reason we're not living in trash-filled slums, because we pay our taxes, and that goes towards having people actually come and clean up our garbage. So here are some practical measures that we need to think about. And, a lot of this is kind of duh. I'm sure you have the common sense to think about this. So are we dealing with an application that requires sterilization, or can we just disinfect something? If you're talking about surgical tools, then yep, we want those sterilized because we're cutting into sterile tissues. If it's in a person's hospital room, then yeah, disinfection is going to be adequate, because we're not going to be able to stick an entire room inside an autoclave, and a lot of the things in that room would be destroyed by following autoclaving or sterilization. Is the item, are we going to try to reuse it, or are we going to use it once and then throw it away? If we do need to use it more than once, is it something that can stand up to being autoclaved? or by having, a sterilant applied to it. Does it fit that application? Is whatever we're using going to penetrate to the necessary level? Is it safe? Is it going to be, and this is a big thing, cost and labor efficient? Okay, so we'd love to stick everything in an autoclave. Guess what? Money-wise and labor-wise does not make sense. Okay, so let me stop here and get this uploaded. I'm going to start here in our next lecture. Okay, thank you.